Good day, everyone. I welcome you all once again on our today's health talk. Today, we are going to look on reproductive health, its components. We're going to talk on reproductive health and its components. So now we are going to start. What is reproductive health? Reproductive health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters relating to reproductive system, its functions and processes. So this reproductive health is talking about everything concerning someone's health, pertaining to the reproductive systems, the functions of it, that is concerning the anatomy, physiology of the health. So now, what are the components of this reproductive health? We have a lot of components of reproductive health. Number one, I'm going to list them, then after listing, I will explain. Number one, we have family planning. Number two, we have maternal and newborn care. Number three, we have prevention and management of unsafe abortion. Then, number four, we have reproductive transmitted infections and sexually transmitted infections. Then, number five, we also have prevention and management of HIV and AIDS. Then we have the last one, but not the least, which is the promotion of healthy living. So now let's start the explanation. Let's start the explanation of all the components I listed. Number one, I made mention of family planning. What is this family planning? Many will ask question, what is family planning? Yes, family planning is a practice of controlling the number of children one wants or desires to have by the use of contraceptive measures. We have a lot of contraceptive measures, the use of injections and the rest of them. They have different contraceptives depending on the one that the person's body accepts or is suitable for. So another one, I made mention of prevention, maternal and newborn care. Maternal and newborn care is the care given to a mother and also a child. Let me use this word. Is a care given to a mother and a child, or you said prenatal, postnatal, and prenatal, antenatal, and postnatal care. When I say prenatal, it's before pregnancy. A mother that wants to conceive, first of all, there are things you need to do, like you have to go for treatments, check your health, and know if your body is suitable for the pregnancy. If you're having any infections or anything, you have to treat it before you conceive, before you talk about getting pregnant. So that is the prenatal care. Now the antenatal care is by the time the woman is pregnant. These are the care given to that woman during the time of pregnancy to ensure the safe of the mother and the child. Then the postnatal care, let me use the word fetus for the antenatal care because the child is still in the womb. It's called fetus. Then the postnatal care is the care given to the mother after she has given birth to the baby, to the neonate. Now, number three, I made mention of prevention and management of unsafe pregnancy. Yes, through this, many youths or mothers are being educated on how to prevent unsafe pregnancy and unsafe abortion, because when you have the knowledge, you will know what to do to prevent unsafe pregnancy, which will lead to unsafe abortion. Even the youths, some people lack the knowledge, whereby it leads them to have a kind of risking their lives or even endangering their system, like their reproductive systems that help them to conceive. By the time the person, if he's a youth, by the time this person reach the age of getting married to conceive, you'll be looking for issues. You not have the opportunity to conceive again because you have caused a lot of damage to your reproductive cells or organs. Now we have the prevention and management of reproductive tract infections and sexually transmitted infections. Yes, in this reproductive health, women are being taught, not only women but both men and women, they are being educated on things to do to avoid contracting infections that will lead them not to conceive. Some people did not know that infections can prevent someone from conceiving. Yes, many that even know that infection can prevent them from conceiving, they don't take it serious. They think that is a minor thing. It's good for one to check yourself before you talk about getting pregnant, because when you are having infection and you don't treat yourself, it's going to affect you during the time of pregnancy, even your unborn child. So it's good for one to treat oneself from infections, from any reproductive tract infections and anything sexually transmitted infections. These are the infections that affect infertility, whereby leading the woman to become infertile. You cannot be able to conceive anymore. So another one is HIV. Many women that have this disease did not know how to prevent their children from getting it from them, because they need to be educated on what to do so that their unborn child cannot get this sickness from them. There are ways, or things a pregnant woman need to do to prevent her transmitting this particular disease to the unborn child. There are things you need to do. They need to go to hospital. That's why I made mention of antenatal, that is maternal and newborn care. If the woman goes to hospital, they need to be educated on things to do to prevent them from contracting infections or this HIV, or transmitting it to their unborn children, or even to the members of the family. So the next one is, we also have healthy living, to promote the healthy living. Yes, when in this reproductive health education, people are being educated on how to promote their living, especially the pregnant, because whenever you're talking about reproductive health, it's talking about pregnancy, how one can, your everything, every organ on in your body, how it's going to function for you to be able to conceive and also live healthy. Not only conceiving but also live healthy, both the man and the woman. So in this particular aspect, the mother or the father need to be educated on, especially the pregnant ones, on what the kind of things they need to eat. Do you know that there are things you need to eat that will help to promote your hormone? There are a kind of fruit or food one needs to eat that will help to improve the hormones in your body, to boost it. The same applicable to a man. And there are things a woman is not supposed to eat that is very acidic or very harmful to the, or poisonous to the body, that when you are pregnant they will tell you don't eat this, don't eat that is not good to your baby or your born child. So this period, a woman needs to, as in, the woman needs to be educated in every aspect of health, for one to know the do's and don'ts, so that you will not go and cause harm to yourself or to your unborn child, or even, like I made mention of, transmission of infectious diseases. There are things you need to know, so that if you're having any infection, you know things to do too, so that you will not spread it to the members of the family. Thank you so much for watching. Please subscribe. Don't forget to subscribe, share and like.